So this table provides a list of the currently available systemic fluoroquinolones and the year they were initially approved. So of the three indications that we're going to discuss today, this table summarizes the labeled indications for the various systemic fluoroquinolones that are currently in the market. I think it's worth noting that the indications may not be identical across the various drugs, given that these were approved over a fairly long period of time. So as in any other labeling, the labeling for systemic fluoroquinolones has specific sections that address the various safety concerns that have emerged. So the products carry a boxed warning regarding the risk of tendinopathy and tendon rupture and the risk of exacerbation of myasthenia gravis. The warnings and precautions section, again, across all labels is not identical, and this is not an all-inclusive list, but these are the more common ones, and they are seen across the various fluoroquinolones currently in the market. Hypersensitivity reactions, hepatotoxicity, effects on the central nervous system, risk of peripheral neuropathy, prolongation of QT interval, blood glucose disturbances, and photosensitivity. In addition, the adverse reaction section of the package insert lists the adverse reactions seen in clinical trials and post-marketing. In addition, all systemic fluoroquinolones have a medication guide as required under 21 CFR 208.1. So with every prescription of a fluoroquinolone, patient is required to receive a medication guide. So I'll just provide a quick overview of some of the key safety labeling changes that have occurred over time. The first one is tendinitis and tendon rupture. So for some of the initial fluoroquinolones, information was included in labeling about the non-clinical information that we had on joint pathology with these drugs. Subsequently, once clinical information became available, it was included in labeling for all marketed fluoroquinolones. And then as new fluoroquinolones came along, a warning was included as part of a class effect, even though there were no instances of this particular adverse effect in clinical trials. In 2004, the warning was expanded to include the at-risk populations, and in 2008, a boxed warning was added to describe the risk and the at-risk populations. Again, from the very beginning, labeling for some of the fluoroquinolones have included the potential for central nervous system adverse reactions, and the most recent update was in 2011 when pseudotumor cerebri was added. In 2004, the labeling for the fluoroquinolones was updated to include